We are student-assisted medical and dental applications. As society, are bought in the London School of Medicine and Dentistry, but you can call us SAMDA. As a society, we are dedicated to support schools, colleges, and sixth form students in their first step towards a career in medicine or dentistry. We conduct school visits to give you that personal guidance, clinicians' evenings with prestige alumni and professionals, skills days to equip you with all the skills to ace the application, mock interviews with students and clinicians to give you that first-hand experience and get you ahead of the game, a buddy scheme so that we at SAMDA can support you every single step of the way, weekly tips on our social media to give you some bite-sized and concise wisdom and advice. If that's not all, our extensive SAMDA medicine and dentistry guide and much, much more. Check out our social media and stay up to date. We are only a click away. We are student-assisted medical and dental applications. As society, are bought in the London School of Medicine and Dentistry, but you can call us SAMDA. As a society, we are dedicated to support schools, colleges, and sixth form students in their first step towards a career in medicine or dentistry. We conduct school visits to give you that personal guidance, clinicians' evenings with prestige alumni and professionals, skills days to equip you with all the skills to ace the application, mock interviews with students and clinicians to give you that first-hand experience and get you ahead of the game, a buddy scheme so that we at SAMDA can support you every single step of the way, weekly tips on our social media to give you some bite-sized and concise wisdom and advice. If that's not all, our extensive SAMDA medicine and dentistry guide and much, much more. Check out our social media and stay up to date. We are only a click away. We are student-assisted medical and dental applications. As society, are bought in the London School of Medicine and Dentistry, but you can call us SAMDA. As a society, we are dedicated to support schools, colleges, and sixth form students in their first step towards a career in medicine or dentistry. We conduct school visits to give you that personal guidance, clinicians' evenings with prestige alumni and professionals, skills days to equip you with all the skills to ace the application, mock interviews with students and clinicians to give you that first-hand experience and get you ahead of the game, a buddy scheme so that we at SAMDA can support you every single step of the way, weekly tips on our social media to give you some bite-sized and concise wisdom and advice. If that's not all, our extensive SAMDA medicine and dentistry guide and much, much more. Check out our social media and stay up to date. We are only a click away.
Okay, hello everyone. Thank you all for joining in. This is Samda. My name is Rowan. I'm a second year dental student. We're going to be presenting ethics in dentistry. So firstly, I hope everyone's well. Before I start saying anything about the topic, just want to give you some background about our society. So, brilliant. So we are a student-run society, and we are based in the University of Bath and Queen Mary. Our society is aimed to support sixth form students, so 16, 17 years old, or even those who are taking a gap year or postgraduates, who are applying into dentistry and medicine. We're helping these individuals in their journey into getting into their into medicine and dentistry. This includes personal statement, UCAS application, interview preparation, and some UCAT preparation as well. So regarding today's live stream, unfortunately, all YouTube comments are going to be off for safeguarding reasons. If you want to ask questions, go to the Instagram page, Bart Samda, post your questions there and we can go through them in the live stream. If you have any concerns, please email the email on the screen and make sure you CC the school teacher in the email. So yeah, if you want to put questions, go to the Instagram, post your questions onto our page, and hopefully we'll be able to go through it today. Okay, going back to our topic, ethics in dentistry. Now, in the UK, the word ethics is associated to the GDC. So this is a big term that we need to learn it before we dive into the topic. The GDC stands for the General Dental Council. It's the body that sort of makes regulations, making sure that any dental professional undergoes sufficient training to be registered. So yeah, it regulates dental professionals in the United Kingdom. So registered or qualified dentists and other dental care professionals. So, it's not just dentists. This includes dental hygienists, dental therapists, dental nurses, dental technicians, and clinical dental technicians. The General Dental Council has its principles that must be followed at any time, okay? And just to give you some relatable background, some of you might have heard of the GMC, which is basically the medical version of the GDC. So GMC is the General Medical Council, GDC is the General Dental Council. Hopefully that relationship makes things clear. So we're going to start listing these principles that the GDC has on its documentation websites and for the purpose of training. First principle is you must put the patient's interest first. Second principle is communicate effectively with patients, okay? We're just going to go through them briefly now. We're going to dive deeply into them later on when we go through the slides. So yeah, going through them, we also have obtain valid consent. And, the word valid, there's emphasis on it because, you may be able to obtain consent, but the question is, was it valid or not? And this is what we're going to go through today. We also have maintain and protect patients' information, okay? And this all falls under the term confidentiality, okay? Everything you do in your practice must be confidential, okay? Patient information must not be accessible to anyone and should not be leaked to anyone unless it's appropriate, for referral, etc. And we're going to go through that in detail later on during the live stream. Have a clear and effective complaint procedure. Work with colleagues in a way that is in the patient's best interest. Again, so this is linking to the patient's best interest. And again, there's emphasis on the term colleague. It doesn't say work with other dentists, it says colleagues, okay? Your colleague is everyone in the practice, including the nurse, the dental therapist, the dental, even the dental technician who could be outside the practice, and the receptionist, and the practice manager. Maintain, develop, and work within your professional knowledge and skills. So, in simple terms, don't do something you're not trained to do or you don't have experience in doing. Otherwise, you're going to put patients' health at risk. Raise concerns if patients are at risk. So this is about reporting concerns. Again, we're going to dive deep into that later on. And then finally, make sure your personal behavior maintains patients' confidence in you and the dental profession. Okay, so we briefly went through the GDC principles, and explain what the GDC is. Just to repeat, it's the General Dental Council that regulates dentistry in the UK. Just an overview of how the session is going to be run after this is we're going to go through each principle. We're also expecting a guest speaker. Dr. Zamin will join in to have his thoughts and his ideas and experiences regarding these principles. One thing you might be thinking, how is this related to ethics? Well, because, as humans, different nations, historically, humans have had debates about what is considered ethical and what is not ethical, right? But there are some areas where there's no dispute. This is where the GTC comes in. The GTC just makes things clearer to dentists, telling us dental professionals what is considered ethical in dentistry, what you should focus on. Because again, ethical is a broad term. There's so many fields and areas of, careers and professions and fields where things might be run differently. GDC just sort of streamlines it and makes it clear and unified and standardized for the dentists in the UK. Okay, so you don't have to read, to be an ethical dentist, you don't need to read many philosophical books about ethics. For the purpose of dentistry in UK, go to the GDC website, read their documentation, and that's why they're relevant to our topic today. And stay tuned as well, because later on, towards the end of today's session, we're going to go through scenarios where they could be asked in interviews and how to answer them. So we're not only going to go through the ethics, we're also going to show how you can sort of apply them in your application for dentistry. Okay, so let's focus on the first principle, patient's interest first. Now, again, each principle is broken down to standards to add details to what they mean by patient interest first. And before I go into the details, I just want to say that there's a powerful message here to put this as the first principle. And the message could be that, all the principles fall under this umbrella. Everything you're doing is for the sake of the patient's interest, and that is what you should be prioritizing. So let's look at the first standard. So you must listen to your patient. Okay? This might sound obvious, but when you're running a busy practice or you're in a busy hospital, it's so easy to fall under the habit of trying to multitask, listen to a patient, and maybe writing the notes or booking another appointment, etc. He is telling you, don't do that, don't multitask. Make sure that you're solely focused onto the patient and listening to them. And make sure you show them that you're listening to them. There must be this body language where there's eye contact, you're nodding, when they're asking questions, you're making sure you're answering promptly. Because the idea is when you show them that you're listening to them, they feel like, okay, I'm in an environment where the clinician in front of me cares. Okay, they're trying their best to show that they care as well. And if the patient sees that, they're more likely to come back to the practice. On the other hand, if we have sort of this idea and the patient said that the clinician is being neglectful or not paying much attention, they might feel unsafe or unhappy of the way they're being treated, and they may not come again. And the problem of them not coming again, whatever problem they have, might get worse because it's not being monitored and followed by the clinician, the dentist, or the dental hygienist. We must treat every patient with dignity and respect at all times, okay? Our uni is in London. We have people from different backgrounds, different abilities. You gotta treat them all with dignity and respect, no matter what, okay? Be as open as possible, as respectful as possible, because again, if they feel they're being treated with dignity, with respect, they're more likely to come again. On the other hand, if they don't get that treatment, they won't come again. And that is bad news because problems accumulate, and then they might come when it's too late, or the problems have accumulated too much that you have to do more and more difficult procedures that have more complications, and we don't want that. You must be honest and act with integrity. Okay. There isn't much to say here. This is quite maybe something that there's a consensus on this. On any field of any career, you must be honest. You must act with integrity. Just because, you know, being deceitful or being caught, being a liar is just builds a toxic environment, and we don't want that. Okay. One thing to also mention: dentistry already has this sort of an attack from maybe media and movies and stories about, you know, dentists with the needles and they're scary and all of that. So you have this idea of some adults having dental anxiety because of movies or cartoons or stories they've read or watched. Same thing with children. So you wanna present your best of yourself when they come here, so that you're wiping all of these misconceptions that they've collected from TV or the internet about dentists. You must be holistic and you must take holistic and preventative approach to patient care. Okay, what does that mean? This means you have to take into account that every patient is different. And when you're providing a treatment, you have to look at all the factors. So health, financial, background, social, and you need to try your best to have a preventative approach. What does that mean? It means like, don't wait for the patient to have a problem and then solve it. It's better to teach the patient, educate them on not having that problem from the first place. What do I mean by that? So maybe a patient comes in, they're a heavy smoker, and they reveal that they're a heavy smoker. Advise them about the consequences of smoking. Educate them that perhaps they should consider smoking less often for the sake or for their own benefits in terms of oral health. Holistic approach, it means, sometimes the best treatment could not be the best for the patient. So you might offer a treatment which, in your professional experience, hello, Dr. Zamin joined us.
Hi, how are you, Rowan?
I'm good. How are you, man?
Yeah, good, thank you.
You had a long day, man. How was everything?
Yeah, started off with a 2-hour train journey. We'll talk about how DFT after university works. But yeah, no, I was just jumping in and listening to what you said about the smoking. And I think what a lot of patients don't realize is they know how it affects, their general body, but they may not necessarily understand completely how it affects their mouth. And when you give them that perspective, it really helps them. That's what I've really seen with my patients.
Yeah, that's an interesting point. Even when I was doing my sort of interview preparation to apply to dentistry, it seems like, asking relatives, asking friends, asking teachers, it seems like the public has more understanding about the whole body and their health and, bad habits and wrong habits, but there isn't much focus or
teeth
on your teeth, or gums as well, isn't it? And it's interesting that you've mentioned you see that already in your the practice or the hospital that you do your training in. Sorry, Dr. Zamin, I forgot. So do you want to maybe introduce yourself to the audience first, and then we can carry on with our conversation?
Yeah, no problem. So, hi guys, mine's Zamin, as Rowan already mentioned. I was part of Sanda while I was at Barts. I graduated in summer, and I've just started my training in Bedford. But part of my journey has meant I've moved to Peterborough, so I'm in a new place.
Okay.
Yeah.
I just want to double check with you, Zamin. When you speak, do you hear an echo?
Slightly, yes.
Okay, so I'll try and mute when you speak because I think that's from my end. So we were talking about, just to give you an idea of what we covered, we briefly discussed the GDC principles, listed them, and now we're diving deep into each of them. So let's go with the next bit. So you must treat patients in a hygienic and a safe environment. I think for applicants, you don't have the training or the right amount of information to sort of know what's it mean by hygienic and safe environment. You get trained about this during the dental school. So you know that it must be hygienic, but I don't think at your level for 17, 16 years old or people who hasn't done a healthcare degree, they wouldn't understand what it means by hygienic and safe environment. Zamin, you could correct me if I'm wrong. What do you think? What are your thoughts on this?
No, 100%. At the end of the day, guys, they know that you're not a dentist or a dental student. They know you're just A-level students. So they're not going to expect you to know not only about, the autoclave and all these hygienic requirements that must be met, but even about treatments. They don't expect you to know all of that. They mainly want to see that you can reflect on what you've seen and how you can show this in your life. So don't get too bogged down on the nitty gritty with the dental side of things.
Yeah, 100%. I agree. And then you must treat patients fairly as individuals and without discrimination. So yeah, this sort of links to treating patients with dignity and respect. Again, being in London, we do have patients from so many different backgrounds, different abilities. You must treat them all justly. Don't discriminate. Be as open as possible to be helpful. Again, this all falls under the reason that you don't want them to feel uncomfortable, because you want them to come back and carry on their treatment, because it does happen a lot, isn't it, Zamin? You probably have experience with patients don't turn up or they're late and they have to cancel. What are your thoughts on this?
Yeah, I mean, it's very easy to become frustrated when patients cancel or they don't turn up, but there sometimes are good reasons. And even when they're not, don't discredit one person by saying, it may be in a minor way. You might think, for example, you may standardize and say, oh, these type of people are always late, or, this, that, and the other. But try and just keep an open mind, and it speaks for itself. I mean, treat people how you want to be treated at the end of the day, right?
Yeah, exactly. I remember one lecturer said, it helps if you put in the perspective that they're your family members. Treat them like you would like another dentist treating your family members, isn't it?
Yeah, exactly.
I know some family members, they can sometimes have, they can be misorganized and forgetful. So if a dentist is seeing them, I would like them to be understanding of this. So maybe when I become a dentist, I should be understanding for sometimes that people get busy, people become forgetful. I should treat anyway, right? So let's move on to the next slide. You must put patients' interests before your own or those of any colleague's business or organization. Yeah. So it speaks for itself. You shouldn't prioritize anyone before the patient. Okay, patients come first. Whatever you do, it has to be them first, and then consider other factors or other parties. Although I'm wondering where could be like where would there be a scenario where this could be tested, because there's no case where you either save the patient or you're gonna die. This is not like a.
It's not really a dental thing. That's the thing. It's more. It does come to it when it comes to consent, for example. So again, don't worry about the nitty and gritty, guys. But in terms of if a patient doesn't have the mental ability to consent effectively for their treatment, and there are checklists that you need to go through for consent. You can't just say, okay, I'm going to do this. Is it okay? You have to completely understand and make sure that they're, good to make that decision. But with patients who, they may have medical conditions preventing them from giving valid consent. And this is mainly in effect when that comes into the scenario where you need to think, okay, I can't get consent, but I need to act in their best interest, and therefore this is what I would do. And you may want to get another opinion to validate what you want to do, but otherwise, it's mainly life and death things are, other scenarios. But you may get a medical emergency, where a medical emergency is where something happens where it needs urgent treatment, or it may escalate, and unfortunate events may occur. And in those instances, you have to just act and save the patient. Say, for example, if they're having an allergic reaction and they need that adrenaline, or whatever it is, then you need to put them first, and then make sure what you're doing, you put it on the back burner if you can, and then see to their interests.
Okay, yeah, that makes it clear to me. Thank you. Yeah, so is it up to 7? Oh, there's more. Okay, so 8. You must have appropriate arrangement in place for patients to seek compensation if they have several. Yeah, I think, correct me if I'm wrong, Zamin, is it speaking in case if you do something wrong, accidentally, medically or dentally wrong?
I believe.
Yeah. So, what are your sort of experiences about this? Any colleagues? Any thoughts on this?
So, I've heard stories. Because you have your teachers supervising you, you're not really gonna, hopefully not make a detrimental mistake. And even if you do, to be honest, you put your hands up and you just say, "Okay, I'm human," but patients are humans at the end of the day. Like, they have a right to be upset with something, they have a right to complain about something, and we have every practice and every hospital, wherever you are, will have steps in place to make sure that patients can, make a complaint, feel heard, and then if they want to raise that, they can. And that's why you have indemnity there for you. And indemnity is basically, you can think of it like insurance. It just helps you to understand it if you think of it like that. So they'll provide you advice. What would you do? They give you impartial advice, and then if the patient chooses to escalate it further, then it would go from there. But I've only ever heard stories about it. I haven't really come across it myself.
I see. Okay, fair enough. And I think that's the last standard. So find out about laws and regulations that affect your work. Yeah. So because society as a civilization, it just evolves, right? And with new things coming up, new regulations come up, new laws come up. So make sure you keep your knowledge of these laws and regulations are up to date, because you don't want to be doing something that's outdated and is considered maybe harmful or even illegal. Zamin, your thoughts on this?
No, 100%. I agree. It's the science, right? So science is always changing. We learn new things. So you have to always update your skills, and you go on courses and things. And that's just to put your patients first, so that what you're doing is science-based and it's in their best interest at the end of the day.
Exactly. Okay, so move on to the second principle, which is communicate effectively with patients. Let's look at the first one. So we discussed about listening to the patient, but now sort of the second layer of listening to them would be to give them time to sort of absorb the information you've given them. Because when you, at least from a work experience, when I saw the dentist speaking to the patient, it was more like a discussion. So he would say, "This is what happened, this is the evidence, this is what I think is best for you. What are your thoughts?" And then they would wait a little bit, they'd ask questions. "Okay, could you explain this? Could you explain what does this involve?" And yeah, so you gotta be, it's not you're not lecturing the patient. You're not just saying this, that. Okay, next appointment. It's a discussion, and you gotta give them time to absorb it. Zamin, what are your thoughts on this? How could someone sort of implement this as a dentist, or maybe as a student?
Yeah, no problem. So there's a big thing in dentistry. I'm not sure if you guys would have heard of it listening, but shared decision making. So it's what it says in the tin: shared decision making. Together, you're discussing with the patient what their values are, what they have as their aims. You take that into account, and together you discuss the options available, and you share the decision making process. So sometimes in your interviews, you may be asked certain things with regards to your work experience, and some of these buzzwords are things you might want to throw in. But yeah, shared decision making is a very big thing at the moment.
I see. Okay, fair enough. So here, Zamin's giving you like a golden keyword for the interview. Um, and I think the other bit that I forgot to mention is also take their individual views and communication needs into account. And I think I saw that once in one of the practices I did work experience. It's one patient couldn't speak English, so how could you communicate with them? How could you obtain valid consent, right? Because valid consent means you need to understand what you're saying to consent to. And what they did, they brought in a medical translator. I think that's what the
Yeah, yeah.
what the title is, and that's how they obtain the consent. They've relied on this medical translator to explain things. And here's the thing: it would be nice if the patient can bring someone with them that speaks English, like for example, maybe their siblings or their parents or their maybe children who are grown up who can speak English and the native language. But the advantage of having a medical translator, which what I realized at the time, is the medical translator knows these exact medical terms, these complex medical terms, in the native language of the patient. So yeah, like literally, I remember the patient came in and they couldn't speak English, and I was like, this is gonna be chaos.
Yeah.
But then they just called in the translator, and everything just ran smoothly, and I was just like surprised. Zamin, I don't know, did you come across of such things? What are your thoughts on this?
I did once whilst at uni, and yeah, you hit it the nail on the head. The patient needs to understand exactly what it is that's going on, and sometimes their siblings or whoever it is that they bring in may not be able to word that as well as you need it to be, and you can't always guarantee that the patient has 100% understood what's being said to them. And I've also heard stories of people being unsure if the correct thing is being translated. So that's a whole different topic. So there are a couple of reasons why the actual qualified translators are brought in. And there's also something called language line as well. So hospitals have that, and I'm not sure if it's available to practices, but that's a phone line that some people use.
Oh, okay. So, and is that for dentistry and medical, or is it just dentistry?
I'm not too sure about the medical side of things, but
Okay.
I know that people had access to it at the dental hospital at Barts.
Okay, that's very good.
Other unis
Okay.
probably have access to it as well, to be honest.
Okay, fair enough. Well, this is good. So sometimes, because I guess maybe it's not feasible to always bring that medical translator in person, which means having that alliance quite a game changer, isn't it? And again, sorry.
Especially with COVID, yeah.
Yeah, isn't it? Because having things in person became a lot way more difficult. And I was going to add to this is that, yeah, never mind, I forgot. Let's move on.
No worries.
Okay, you must recognize and promote patients' right to and responsibility of making decisions. Yeah, so I think Zamin already touched on this, which is about what was the golden word, the golden phrase, shared decision making.
Shared decision making. Yeah, there you go.
Yeah. So yes, you are, as a dental profession, you have experiences, you're qualified, you know what you're doing. And again, the patient's making a decision, but you have to make it clear that when they're making that decision, it's their responsibilities.
Yeah.
You're presenting all the options, and you're presenting your opinion, your expertise on what option is the best, but then you're letting them choose, but you have to make them aware that whatever they choose is their responsibility. What do you think? What are your thoughts on this, Zamin?
No, 100%. I completely agree. I think it's important for us to highlight, each route and what would happen, but ultimately it's the patient's choice. So sometimes patients, I don't know if you've experienced this, but sometimes patients have actually rejected the preferred form of treatment in, diplomatic ways of saying. And you just have to respect that at the end of the day. So whether they choose, remember, and guys, no treatment is also an option. That is also a treatment plan. Like it is part of it. So for example, if a tooth has decay, the options would typically be remove the decay and fix the tooth, restore the tooth, or depending on how severe the decay is, you may need to extract the tooth. However, the third option that a lot of people forget is actually no treatment. But again, you need to plan all the things that could possibly happen if that wasn't the case.
Yeah, you know what? That's interesting because you just brought to me something else that I found surprising. One of the patients came lost a tooth. They were young, I think, and they lost one of their front teeth, right? So it's kind of obvious they came in to sort of replace that tooth, whether it's a bridge, implant, denture, etc. But then when the dentist talking about the options, what they can do, he also explained what would happen if they leave it, right? And the reason why I found that surprising, well, in my head I was saying, well, they came here for the reason of filling that missed tooth, isn't it? But the dentist felt the necessity of explaining what would happen if you leave it anyway, because I think what clarified to the patient, because patient in their head, because they're young and they lost one of their front teeth, they thought this is just a cosmetic procedure, right? But then when the dentist explained it, that okay, your teeth will start moving because there's a gap there, and he also talked about over eruption and other teeth might be affected. Then it sort of created this image that this could be a functional problem as well, not just cosmetic, which I found very surprising and interesting, and is linked to the great point that you've mentioned. So yeah, next standard. You must give patients the information they need, the way they can understand it, so that they can make the decision. Yeah. So all the information necessary to make valid consent must be given to the patient in a way they can understand. So if English isn't the main language, call the line, as Zamin mentioned, get a translator, or if you can bring a translator in person, that would be great. What other cases could it be where communication is a barrier? So a way of understanding what you're saying is a barrier, other than native language. Could you think of anything else?
PEDS is a big one. Pediatric patients. Pediatric patients.
Oh yeah.
So children. So a lot of the time, even with adults, we have at university, we had booklets that we would provide to the patient so that they could take home and read what we've spoken about. So sometimes, and this will happen a lot of the time, you will go through ages taking consent from the patient, talking about every treatment option available, but it's so much information, and obviously not everyone can remember all. In fact, very few people can remember everything. So you give them this sort of leaflet and it helps them understand it. So some places have it as like a flow chart and a diagram. Some places will give it as a leaflet, but it's just an easy way to, take in that information.
Yeah, I think that's an interesting point you brought up about, communication isn't just verbal, right? In your case, you've mentioned, creating these leaflets, creating these diagrams to make things easier to understand for, like you mentioned, children, for pediatric treatment, or for adults. So clarify the communication even further, which is what we want, isn't it, to obtain that valid consent? Interesting. You must give patients clear information about costs. Oh, okay, yeah. So again, this is about, you don't want to seem malicious because sometimes, you might say the dentist doesn't have the intention of hiding the costs. But if you don't display them clear, the patient can only think that the dentist is being malicious or giving us treatment and then charging us for something that we weren't aware of. So to avoid that scenario, just always be clear. Have it on your website. Have it at the front, maybe if you're, in front of your surgery, and make sure the receptionist knows about these. So in the waiting room, patients ask, she can answer. But what about students? Do you think students should have this sort of? No.
I think it's important to know how the NHS system works, but you don't necessarily need to know about costs. In fact, as part of Dental Foundation, you're fresh out of university, you're basically a newborn baby into the world. You have dedicated trainers specific to you in my case, there are 2 trainees. There are 2 foundation dentists, so we have 2 trainers. It's basically a 1-to-1 ratio, so it's quite specific and targeted. But as part of the training with those trainers, once a week there's a protected time for a tutorial. So in some of I've had a couple this week already, and in a lot of them, costings came up, and it's something that I'd never previously done as part of uni, right? So one thing with the NHS that I learned is, and it may be that this changes because apparently a new NHS contract will be coming out soon. But apparently in the NHS, they don't really collect debt. So you have to pay upfront for the treatment. So you talk about the treatment plan, and then prior to the treatment being started, the patient then has to pay. And you just have to be upfront and honest about costing, because it's a big factor for patients. And some of us are, we're quite fortunate. We might think, okay, 250 quid or whatever it is for a band 3 treatment with the scaling, with the endodontic root canal, with the crown, we might think it's quite cheap. But there are lots of people out there who unfortunately find that a steep amount, and it does affect the treatment options a lot of the time, because they may not be able to afford the root canal and crown, which would be a total of like £280, I think it is, around that amount. And they may only be able to just afford the extraction, which is, I think, around £50-60. So it is really important, and it does affect the treatment that's given at the end of the day.
Yeah, totally. I think you're right, because it also falls under the category of holistic treatment, because in the example you've given, a dentist might say, well, I think the best thing to do is give you a root canal and then put a crown on top of that. But because the patient has financial preference to the cheaper option, they might go for the extraction, which is, again, you have to respect your autonomy, but gotta explain it. And again, just to reiterate what Zamin said, the cost, the financial consequence of the treatment is a big factor for many patients. So you have to be as clear, as open about it to them. Okay, third standard or third principle, I'm going to go through the standards, which obtaining valid consent. Again, emphasis on the word valid. So you must obtain valid consent before starting treatment, explaining all relevant options and possible costs. Before going into that, it seems like things are sort of repeating, isn't it? Yeah, like possible cost, explaining, and I think the reason why they do this is to put emphasis. Okay, you shouldn't have an excuse for missing out on these fundamental things for ethics in dentistry. So yeah, be aware of that. Perhaps something to talk about in your interview. Say I've read about the GDC principles, and I've realized that there are certain sort of fundamental standards or principles are reoccurring, and from that I did that, blah blah blah, etc. So it's worth noting that. Yeah, so I think we've gone through that already. Anything you want to add? I think this is like gone through it.
No, really, I think we mentioned it before. Again, as Rowan said, it's just they want to emphasize it, so that's why it comes up a few times.
Must make the patient or their representative understand the decision they are being asked to make. So I think the takeaway, the important thing to look at this is representatives. So Zamin, maybe you've got more experience. What does it mean by representatives?
So it may be, before, like we spoke about pediatric patients, it may be people who mentally aren't able to consent. So the key word for me in this whole slide is valid. So you guys will learn more about consent taking when it comes to university. And as I said earlier, you don't really need to know the nitty-gritty about it for your interview and for the application process. But if you do know these things, it will stand you apart, because not many people understand, bits and pieces that we are talking about in this conversation. So the word valid consent, or the phrase valid consent, there are a couple of key factors. So one major one is that the patient needs to be able to understand what's being said to them. They need to be able to retain what's being said to them, and they need to be able to repeat back what's being said to them. So I actually had a tutorial on consent yesterday, I think it was actually, and I learned yesterday that different people have different styles of taking consent. So remember, we said understand information, retain information, and relay back information, right? So on the third point, relaying back, one of my trainers basically said that one way he likes to do things is sometimes question the patient. What have you understood from what I've said? What were the pros and cons of this treatment? Giving them questions so that you know for sure that they've understood it. Because if for whatever reason you think that the consent isn't valid, then it can pose as a legal issue. And then I'll pass this off to you now, Rowan. So in terms of actually, you might have done this actually. There's the Mental Capacity Act. Have you heard of that?
Heard of it? Refresh my memory.
No worries. So the Mental Capacity Act basically says it's basically the criteria for someone being mentally able to give consent. That's all it is. Mental Capacity Act. Do they have the mental capacity to give consent? That's all it is. So that's a big part of, do they understand it? Because then unless they're mentally capable of taking consent, you can't get consent from them. So you need to go through a different avenue, which is when you then highlighted representatives.
Yeah. I think this also links to Competence, I believe.
Yeah.
So like Zamin said, you could consider a patient mentally capable to consent, and there's no need to bring or to involve more people to represent them. Obviously, this is quite, sorry?
It's quite complex.
Yeah. Don't take it, don't undermine it. It's not too easy to classify someone as being mental. So you have to be cautious when you decide on this. And if in doubt, I think there's always, especially when you start or as a student, there's always someone above you that you can ask for their advice, what their thoughts, what do they think. Always do that. Our professional lead always tells us, if you're in doubt, ask someone above you. Don't decide if you're in doubt. When you make a decision, you must be 100% sure, you're able to justify everything, you're good to go. If you're in doubt, always ask someone above you.
Yeah. And that takes us to, there's another principle coming up. I think it's number 7. It's one of the last ones. So based on what you just said, it's a principle that says you need to work within your remit. You can't do things that you're not trained in and you're not comfortable with doing so, because ultimately you'll be putting the patient at risk.
Yeah, exactly. And then again, this whole, just to remind our audience, this whole thing falls under the patient's interest, patient safety, patient's health, right? GDC is patient-centered. Everyone in the dental profession, is working for the sake of the patient. Okay. And yeah, so let's carry on with the third standard of this patient consent management. Okay, so this is quite interesting. Because when I was doing my work experience after finishing GCSE, I was always wondering why there's always, always asking the patient about, do you agree to this? And there's all these signatures and all these papers all the time throughout the whole treatment. Even though the first time they agreed to it, it seems like they were able, like you mentioned, they were able to understand, retain, and say it back to the patient. So to me, at 16 years old, looking at this, it seems like the patient knows what they're deciding. So what are your thoughts on this? Could you give us your experience on this?
Ultimately, we're all human. Anyone can change their mind whenever they want. So I've had someone who, when you're in the older years of university, what happens is you start treating patients in the emergency clinic. So they're in pain, they come in for a problem, and the aim is to get them out of pain. So we've had patients come in who a tooth is in the condition that it either needs a root canal or it needs taking out. A lot of these patients, when they are in such excruciating pain, they will just say, get rid of it. I don't want to have it. It's too much pain. Take it out. But what you can do is you can do certain things to alleviate the pain. This is quite technical. It's called an extirpation. It's basically when you take out the nerve. So when you take out the nerve, obviously, and you clean it up a bit, they can't feel anything. So when they may have initially said, take it out, after speaking to them, they may have opted for you to take the nerve out. And then at the following appointment, when it's not an emergency to get them out of pain, they may have then decided, oh, okay, I didn't need the tooth taken out. I can now save it. That's an example for when they might change their mind. Or there are other times where there are so many different options available. After going home, researching it a bit maybe, or speaking to family and friends, or reading the leaflets that you gave them, they might change their decision. So it's always important just to check.
Okay, you know what? That is very, very intriguing and thought-provoking for me. I've never thought of the idea because, like you said, patients' emotions and what they're experiencing at the moment will affect their judgment. So you want to make sure everything is optimized for them to make the right decision, isn't it? In the example that you've given, which is very interesting because I've never seen it, but it's very, it's probably very common, isn't it? When patients come to emergency, they have a problem in their teeth, perhaps an abscess, they need to have their root canal cleaned, and they're just, screaming they want the tooth or teeth to be taken out. And yeah, I think this is where this standards makes more sense to me now. Is that you're making sure you're optimizing the decision-making environment for the patient in intervals to make sure that the consent is valid, right? Wow. So thank you for clarifying this.
No problem.
Okay. So fourth standard, maintain and protect patients' information. I've mentioned this earlier at the beginning. This is all falls under the term of confidentiality, right, Zamin? Do you think confidentiality, summarizes this? So let's look at the first standard. Contemporariness.
Contemporaneous, those of you tuning in, contemporaneous basically means as close to the time of the event as you can. So for example, if I'm seeing Rowan as my patient in the morning and I'm seeing patient X like 5 o'clock in the evening, I'm not going to write Rowan's notes at after 5 in the evening because I may not remember everything, right? Some people do write their notes at the end of the day, and that's completely fine. But for contemporaneous basically means just as close to the time as you can. And I think the DDU, which is an indemnity, as I said, insurance body, that's the key policy that they have. And you don't, for example, want to see Rowan this morning and then I write the notes up on Monday after the weekend, for example, because you're not going to remember half of the stuff that you did.
Yeah, okay. So this is new to me, actually. I didn't sort of dive deep into that term, contemporariness. But it makes sense what you said. But you mentioned it's fine to do it at the end of the day, perhaps if you have a busy day, but it's best to do it as close as possible. But at the same time, you don't want to do it days or weeks after, because here's the thing, like it's as crazy as it sounds, practices see a lot of patients during the week, like so many. There's no way you can remember an individual case detailed the next week or the next few days. And that's why you have to do it as close as possible after the consultation. What about in terms during the consultation? Is that something that is recommended, disrecommended?
Some people, yeah. So some people, I have one of my close friends at university. When she would take her history from her patients, she would just, and I used to do this as well actually, she would just go on the computer and just turn to the patient. Just, they know that you're paying attention because you're turning to them, but then you're still writing on the computer, turning around. And that way you know that you're up to date, because it's also quite a good thing to record a quote from the patient. So say, for example, if they're in pain, you can use words in your notes, and that can further help justify your treatment plan in terms of the notes when you use their phrasing. Because say, for example, if they're saying, I feel like my face has been hit, punched in the face, versus, oh, I'm in pain. There's a big difference.
Okay, yeah, no, that makes it clear. Thank you. The next standard would be protecting confidentiality and patient information. Now, here's the thing. Mm, in an era that was like my opinion, my thoughts on this. This is not necessarily true for everyone, but when I was 16, living in an era where social media is everywhere, where everyone has social media accounts and their personal information is out there on the public, it's so easy as a 16-year-old undermine the reason of confidentiality. But here's the thing I want to highlight. You're recording very, very sensitive information, very sensitive. Not just name and surname and mobile number and address. There's even more sensitive than that. Someone's medical history is considered highly sensitive. You don't want, if someone suffering from a certain disease that they feel uncomfortable people knowing, that is considered very sensitive, and you don't want that to be leaked, let alone other information obtaining from them. So it's very important, whatever information you're collecting from the patient, it's secured, it's not laying around for anyone to access. It shouldn't be leaked. And what else? And I think when is it okay to pass patient information, Zamin? Do you have any thoughts on this? When is it okay to pass?
So when you're discussing cases, it's really good. So dentistry as a career, you can always learn from your peers. Like when Rowan qualifies in a couple of years, I'm pretty sure that I'll be coming to him to learn stuff that he covered at university, because things will change in like 4 or 5 years time when you finish, right? So if I wanted to discuss a case with you, we're more than okay to discuss the case and learn from each other. But what we can't do is, as you mentioned, disclose anything that can be used to identify the patient. So they may have a medical condition that's relevant to the case. They may, if it's an extraction that you're doing, they may have a bleeding risk, right? And that's perfectly okay, because we need to know how these things affect the patients, because we obviously don't want them to bleed out. There was a case at a university, I'm not going to name the name, where there was a patient on a blood thinner. They have different names, but you can call them a blood thinner. And they didn't realize this. The dentist then went and extracted a couple of teeth in a row. And obviously, so yeah, you've heard this then. So they went and extracted a couple of teeth. Obviously, if they're on a blood thinner, then they're gonna bleed a lot. It's quite obvious if they're on a blood thinner. And this patient actually passed away. This was on the news actually. So the news classed it as I can't remember what the headline was, but it was basically dentist killed patient, right? Or extraction killed patient. The media blow everything up, right? They exaggerate everything, but it wasn't the extraction or the dentist, it was the bleeding risk. So discussing a case like this would be very important to learn from it, right? Because there are things you can do to manage patients who are at risk of bleeding, such as doing maybe one extraction and then waiting till do the next one, something like that. So you can discuss cases, you can learn from each other, but with social media, just perfectly as you said, it's really easy to accidentally say the wrong thing and break confidentiality, and it's a big no. You need to be, you need to maintain that all the time. Even seminars when you attend at university, you need to keep those things confidential. And if you want to, when you go on work experience, for example, you may see lab work, you may see patients, you may wish to post on your story on Insta, or you may want to make a post about it. Yeah, exactly. Make sure that if you do, you have the consent from the patient, and nothing on that is identifiable. So if you're posting a model of their teeth, make sure the name isn't there or whatever. But it's a big no unless you have their consent, just as Rowan said with his ex.
Yeah, I just want to mention, I'm really glad you've mentioned that blood thinner case. when that happened, guys, I was applying to dentistry to the university. And, this being on the news was something that I sort of tried to research more, to talk about in my interview, to sort of expand my understanding of dentistry and make it updated. And here's the thing, this links to too many things. Is one, you can see how medical history relates to your oral health, how medicine and dentistry overlaps. So the patients being on blood thinners for whatever reason, maybe they had a heart transplant or a pacemaker, for whatever reason, they were taking medical reason, they were taking warfarin. And this is why dentists need to have strong understanding of the whole body to do appropriate decisions for the patient's oral health. Another thing it links to is that media, which is what Zamin mentioned. There's so many stories, like kids' stories. There's so many movies. There are so many stuff out there on the TV shows that portray dentists in a bad way. That they're scary. They have these needles, or what they care about is causing pain. And then you've got this case happening, and in the media, boom, dentist killed patient. So we have to be very careful as professions, very, very careful. We have to make sure we're presenting ourselves to the public in our best image, because we want to wipe out these misconceptions about our field. Okay, so I'm really glad you brought it up, Zamin. Thank you so much. It literally didn't come up to me. It made things more relevant.
And what you mentioned, Rowan said that about how the body affects the mouth and everything. That's another topic with Samda discussions. So make sure you tune into that. Check out the Instagram.
Yeah.
You're muted.
Sorry. So today's live stream was the second about ethics. Next one's going to be about anatomy. The fourth one is going to be about what Zamin mentioned, medicine and dentistry overlap. And the final one is going to be some exciting x-rays. Which is, again, all the x-rays that I'm going to be showing you on the last session, there's no patient identifiers, and you can get these images from Google. So there's no violation there, right? This is how you're following the GDC guideline. You are sharing interesting cases to educate peers and colleagues, but there are no identifiers. So you're not violating confidentiality. Good. I'm aware of time. We're already an hour. I'm going to say we'll do 30 minutes. Zamin, do you need to leave at some point? Are you okay with 30 minutes? So I think we can finish all these principles in 30 minutes. Then we can do Q&A, guys. Okay? So stay tuned. We're also going to go through very important scenarios that could come up in your interview. So make sure you stay for that, because we're going to discuss appropriate responses to these. Okay? So let's go back to our fourth principle. So you must only release a patient information without their permission in exceptional circumstances. Now, to my knowledge, which is not much as a second-year dental student, the patient, when the patient gives information to you as a dental profession, there's an implied consent that you can pass this information to another dentist if you're going to refer them to them, right? So one case was, I saw a patient came in and they needed to do root canal treatment. But the dentist at the practice said, well, after doing the x-ray, they said, okay, it seems like it's a complex case. I'm going to refer you to a specialist, an endodontist. And from there, he just passed all the findings. He passed the x-rays, he passed the medical history, he passed the consultation notes to the specialist. So I think this is implied consent, isn't it? I mean, you can correct me if I'm wrong.
My understanding of this point is actually something slightly different.
Okay,
so I think in my experience, and this may be completely different, obviously we both have different experiences. For making a referral, what I've seen is that, as literally what you mentioned, the dentist will get consent to refer a patient on. What I think this is actually talking about is more of a safeguarding issue. When you see a patient, it's typically children or adults who have a health condition that makes them more vulnerable, such as dementia or Parkinson's or schizophrenia, something that takes away their ability to care for themselves independently. And with children and these patients, they're often at risk of being abused in some sort of way. A famous one that some of you may know is Stephen Hawking. So his second wife, I believe it was, his carer, actually abused him in some ways. They actually dropped the case. So I don't want to get into it too much. What I know is quite limited about it, but some people said that she abused him. And in this case, it's important to break that confidentiality because it's in the patient's best interest. Exceptional circumstances, in my opinion, refers to exactly that. And this is on the BDA website. If you guys are interested, you can just look up BDA safeguarding, and it tells you when you can break consent. So one thing it talks about is actually asking the patient, can I break consent? So at that point, you're still asking them. You then gauge their response. If you feel like, if they say no, you need to then gauge, is the patient still at risk? Why have they said no? Is it just a misunderstanding, for example? Did they actually fall over? Did someone hit them, for example, or something like that? Kids hurt themselves all the time. It doesn't mean, oh, he's got a bruise in his arm, someone's doing something, right? You can't just assume. So if you feel for whatever reason that something is going on, it's important to put the patient first and break that confidentiality. Again, exceptional circumstances. You don't do this for absolutely everyone. But as a junior, you don't really, you may not have the experience to make these calls. So you can talk to your tutors, you can talk to your practice principal or whatever, associate dentist at the practice that you're at, and then they will guide you through that ultimately.
Yeah. Okay. Fair enough. That's interesting. This is something, again, I wasn't aware of what I meant by exceptional circumstances. Thank you for clarifying this. For the sake of time, I'm going to put all the standards at once on the slide so we can sort of talk about all of them at once for the sake of time. Oops, go back. So the rest of the patient have access to their record, yep, and keep patient information secure at all times. So I think we discussed the last one already about securing the patient's record. Again, whether it's paper or electronically, you don't want it to be leaked, isn't it, to the public without their consent. But the fourth one is interesting. Patients can have access to their records. Now it doesn't really mean that they can, let's say at 12 midnight before they sleep, they want to make sure that someone recorded the right information. They can just go online and see their record. It just means perhaps that when the patient asks for it, they can be provided with it, right?
Yeah, exactly.
Yeah. Because, yes, you want to give them access to their records, but it has to be feasible. Because the records are secured and there are only a certain number of staff have access to them to secure them. I don't think the patient can access them 24/7. There's a certain time where they can. Yeah.
You have to request it.
Yeah. So as long as you're making it convenient for them to do it and it's feasible practically, then you're good to go, right?
Yeah.
Yeah, brilliant. And then to the fifth principle, so clear and effective complaint procedure. And I think this is interesting to me reading this, because as a humans, it's so easy to take a complaint as an attack, as a personal attack towards you, isn't it? But here's what I've learned. You gotta detach that thought, because it isn't the case. If a patient is complaining, whether you personally think what they're doing is right or wrong, this is their right. Okay, this is the human right, and if anything, the right way of thinking about it, at least in my opinion, Zamin could add in or accept or change a little bit, is someone's complaining, that means something went wrong, that means there's something that you can learn from. Right, as easy as that. Don't be offended. Don't let it put you down. No matter at what level you reach in your field, there's always more you can do, and you can always get better from learning how you can be better. Right. So yeah, let's start diving into these standards. I'm going to put all of them at once. There's only a few of them for this one. Okay, brilliant. Effective complaint procedure readily available for patients to use. So Zamin, you've already in a practicing place. What does that look like? An effective complaint procedure readily available.
So my practice has an anonymous box that you can put comments into. Otherwise, we have a practice manager that we have two practice managers. One specifically deals with patient complaints. Typically, practices will only have one practice manager, but mine's quite large, so it has two. But yeah, Rowan hit it on the head exactly. So we are humans. Everyone has a right to say when they're unhappy, and we have to just learn from it. Take it on the chin. They're not out there to get you. They just want to be heard. And sometimes these patients have things going on at home. They have social issues that mean that, you know, they take things a bit differently to how you'd normally expect them to. And because of that, they just want to be heard. They may be, you know, having some stuff going on in their personal life, and they just want someone to hear them out and talk to them. And there was one case that my trainer went through with me yesterday, and the patient made a complaint. All they wanted from the complaint was for the dentist to say sorry. That was it. So something as simple as that is what the patient wanted. So you just take it on the chin, learn from it, and then try and prevent it from happening again.
Yeah, and I think it also, if there's an effective complaint procedure, it ensures that the patient's concerns are being heard and taken into account. So it makes them happy and more willing to come to that sort of safe environment where they feel like they're being heard. And this is interesting what you mentioned there in this example about, you know, the patient just wanted the dentist to say sorry. I think, you know, sometimes you do things and because you're so busy, it's not intentionally, but you might unintentionally do something that can come across as perhaps rude, perhaps unempathetic, and you want these sort of procedures that make you aware of this. Okay, so I'm guessing for in the future, this dentist would be more aware when they do something to say sorry, isn't it? And correct me if I'm wrong, Zamin. This is, I think, when you first start, a lot of that happens, isn't it? And it gets less and less gradually because you've learned from your mistakes. So yeah, it's all about it's all about development and making sure the patient's comfortable, isn't it?
Yeah.
Respect patients' right to complain. Yep, of course. Give patients who complain a prompt and constructive response. Yeah. So it's all about, you know, react promptly. Don't wait weeks and months to respond to the complaint, because then the patient's like, okay, what was the point of me then complaining if you're not going to even do it at that time? And maybe even if you can't, perhaps, let's say, I don't know, would there be a case where perhaps you can't react immediately? So instead of reacting immediately, you can follow up with the patient saying, okay, we've received your complaint. This is what we're going to do. We can't do that right now, but in the future, this is what's going to happen, and we're going to update you with what we do, isn't it?
Yeah, so both are viable. So from what I know, I can't remember which body says this, so apologies for that, but I have heard somewhere from my trainers, and I've read somewhere previously, that you have to reply to a complaint within either 24 or 48 hours. I'm pretty sure it's 24 hours, but you have to acknowledge the complaint, and you can then you have a certain period of time where you have your action plan on how to go forward from it. So both are completely valid, but as Rowan said, you do have to acknowledge it. It's not fair for the patients to just make a complaint and then just be left in the wind.
Yeah, brilliant. Oh, okay, so I wasn't aware of that as well, actually. Thank you for letting us know. So it's 24 hours, and there's a whole, you know, a body that we're not aware of it, which is fine. I think we can find that out if we search it up. But yeah, so there's a whole body saying that this is the rule, so this is the standard. 24 hours, acknowledge it, and then react to it promptly. Not react, deal with it promptly.
Yeah. It's 24 or 48, but I'm pretty sure it's 24.
Okay, yeah. So let's look at the sixth principle: work with colleagues in a way that in a patient's best interest. Now, I've mentioned this at the beginning, guys. Emphasis on the word colleagues. It doesn't say work with other dentists, okay? there's a reason why they said colleagues, because your colleagues are not just other dentists, it's the dental nurse, it's the technician, the dental hygienist or therapist, and the receptionist. All of these, and the manager as well. Everyone who work with is considered a colleague, and you must work with them effectively for the patient's interest. So let's put everything at once. Oops, go back. Okay, so work effectively with colleagues. Good teamwork. Yep. Be appropriately supported when treating patients. Okay, I think this is where we've mentioned, and Zamin gave an example, is that there's always someone at the top that can support you when you're doing something, and it's your responsibility as perhaps a student and a trainee to make sure that you're being supported. Okay, you can't say, okay, this problem happened because that person wasn't there. No, you shouldn't have done this if there's no person supporting you there. Refer appropriately and effectively. Yep. So I think it's the idea. Zamin knows more about this, about referrals to other colleagues, other specialists, other dentists. But how does that work, Zamin? Could you give us some ideas on the referral procedure?
So I've only ever made one referral whilst at university. So I made a referral to there were technically two, but I didn't do one of them. A tutor did that one. The one that I did was to oral medicine. So there was a patient I had who was a heavy smoker for 15, 20 odd years. She had a lesion on the side of her tongue, which is a big area. So we'll discuss that on the next one. Stay tuned. Remember, that's in two episodes time. So be sure to tune into that. Check out the Instagram. So I had to make a referral to oral medicine. So you have to, when it says accept a referral if you're trained, this is in regards to not only accepting the referral, but also making the referral. So if you're not capable of doing something, then make that referral. And if you don't feel comfortable that you're able to carry it out, don't accept the referral, because you need to act in the patient's best interest. So in that case, it wasn't really because, essentially, you need to investigate the lesion. It's simple as that. You need to do the biopsy and you need to find out what's going on, because oral cancer is a big thing. And even if it's something like a root canal or a filling or whatever it would be, only make sure that you work within your remit.
Okay, yeah. So here it is, guys. So it's the idea that, if you want to work effectively with your colleagues, you have to be aware of your, like Zamin mentioned, your limits. Okay, if something is beyond your limits, pass it on to someone who the case is within their limits, so they can deal with it best. It says it only accept the referral if you. Okay, again, if you think a colleague referred to you a case where you don't agree that it's within your competence, within your limits, you
don't accept it.
Don't accept it.
Somewhere else.
And perhaps, what would you do in this case? Would you contact the colleague of why they thought that this is appropriate?
Yeah, colleagues, as it says there. So, just as Rowan said, talk to the colleague about why you think it would be best to refer it somewhere else, because you don't want to just throw the patient around. They're not just a random thing, right? They're a person at the end of the day. So you want to explain to the patient perhaps, where they're going to be referred to, how long it may take, things like that.
Yeah. So again, you have to, like Zamin mentioned, consider that you can't just throw the patients front and backward into your colleague. Discuss things and then do decision for once and all. You don't want to get into this rabbit hole of making a lot of different decisions, confusing everyone and the patient, because the patient will lose trust. He will think, okay, they don't know what they're doing. I don't even trust them for the treatment that they're going to decide, or for the treatment that they're going to do on me. So be decisive and make sure you're doing things within your limit. Communicate clearly and effectively. Yep, this came up so many times. With other teams, okay, and colleagues. Okay, so communication must be effective with the patients and with your colleagues, which is what we just mentioned. So make sure you're making a discussion with the colleague who made the referral to make sure everything is optimized for the patient's safety. Effective management and leadership skills. Now, this is quite interesting. There was a I remember like in my sixth form, we had this sort of debate of dentists and medics of the idea of leadership. Leadership is very, very important in healthcare. Someone has to be there to guide everyone, right? You can't have, it's not because some members of the team needs guidance. It's rather that you need one voice standardizing everything. And often in healthcare, I've seen, especially in hospitals within nurses, there isn't one leader. They take like shifts, like rounds. Like for example, one day they would say this nurse or maybe this dentist would lead this department, and then the next day another person. It's the idea of unifying a voice of making decision. Yeah. So one person discusses everything with everyone, collects all the necessary information, makes a decision, and everyone follows. Okay. Otherwise, you're going to have multiple people doing multiple things that are not linked to each other, doing decisions that could clash, and you don't want that. So be aware, leadership isn't in a sense that you need to guide those who need guidance, who are lost and don't know what they're doing. It's rather to make things optimized, make sure that everyone's doing the same thing, following the same pathway, and there's no clash. What are your thoughts on this, Zamin? Have you seen such a thing? Where do you see leadership in dentistry?
Exactly that. And I think a really important one is between you and the nurse, especially because ultimately you're in the nurse has certain things that they can and can't do. You have certain things that you can and can't do, but ultimately the decision in treating the patient is your call. So you need to, for example, communicate with the nurse about what you're going to do so that when the patient comes in, everyone knows what's going on and the patient is, it's in their interest. They're the center of attention, basically.
Yeah, brilliant. So the seventh principle, guys, maintain, develop, work within your professional knowledge and skills. Yeah. So again, we've mentioned this just now. It's about working within your limits. One thing, one of the dentists at my work experience mentioned, it's so easy when you, as a trainee, when things start to working well for you and you're not needing a mentor anymore. It's not needing a mentor. It's rather you're becoming more confident. Yeah, you're realizing that you're getting used to this. You're gaining experience and you become more confident. He said it's so easy from that point to become arrogant and think you can handle everything, and then take a case that is challenging and you think, oh, okay, I'm up for the challenge and I want to do it. But then it's not within your competence, it's not within your knowledge and skills. You shouldn't take it. You should refer it or consult your mentor or whoever, the person above supporting you. So be aware of this. Perhaps it's something to bring up in the interview. Say, I'm aware that when things get better, I need to remain confident, but make sure not to fall into the category. Let's list all the standards. So yeah, I think I've summarized this in my view. What are your summary on this, Zamin?
Yeah, and I think, guys, we've mentioned it before as well. Work within your remit, put the patient, put their interest first. And we said this at the very beginning, but dentistry is an ever-changing career. It's a lifestyle. Science changes every single day. So go on courses. You're required to complete something called CPD, which I think stands for Continued Professional Development. And you're constantly working towards bettering yourself so that you can work within a greater range of skills and treat those patients better, basically.
Yeah, something that I forgot to mention is exactly what you said, the CPD. I'm going to give you another golden phrase other than shared decision making, which is, I have to try and mention in the interview, evidence-based. This is like, so there's a lot of emphasis on this, especially when you become a dental student, especially when you're trained, especially when you graduate even if you're a consultant with PhD, evidence-based comes up everywhere. You must do, everything you do must be evidence-based, okay? you can't do something because, okay, you read an article from Twitter or Facebook and you thought, oh, okay, let me do this in my practice. Okay, this is not evidence-based. Everything must be tested. There are so many medical websites and journals that you have to look into. One of them is no wait. Zamin mentioned the BDA earlier, which is British Dental Association. There's the BDJ, which is the British Dental Journal, and it has all the updated evidence of current practice. You've also got PubMed, which is both medical, biomedical, and dental journals. So look into that. So yeah, this is something perhaps you could mention in an interview, that the importance of evidence-based dentistry. So next bit, standard 8, risks, rise concerns of patient risk. Okay, I think Zamin mentioned that. Perhaps you want to reiterate this and summarize it. Zamin, go for it, please.
So it's basically you wanted to put patients first, and if you see something that's if you see something that's suspect or something that you think if it doesn't, we all have gut instinct, right? Trust that gut because you will know when something isn't right. Number 2, act promptly. You know what's going on. You know it's not right. Raise your concern with a senior colleague. You can contact, as I said, your indemnity because insurance, if you want to call it, they give you impartial advice and they can guide you on what to do. So you need to, if you look at the other points, staff can raise concerns without fear of something happening to them. So it's a positive environment. You want to know that you can say what your opinion is without any reprimand happening or whatever. Effective procedure in terms of raising concerns, as we mentioned, talk to your colleagues, and every practice will have a system in place. You go to person A, then B, then C, and so on and so forth. And then the last one, when you take appropriate action for abuse of children or vulnerable adults. So this is exactly what we talked about before, guys. So it's these people that are most at risk of something happening to them where they may not have the control to stop it from happening. So you need to be there remember, you're a professional, but you're also a medical professional. You need to look after the entire body, which includes the mind, and it includes, the physical aspects beside just the head and neck. So if you see something that stands out, or if you see, for example, like physically or mentally, some signs might be they're reserved or they're feeling down and sort of depressed maybe, or they're not their usual character. It's often a sign that something is going on. Just ask them, how are they feeling? And if your gut instinct tells you that you need to speak to someone, ask them, could I break the consent? Could I talk to someone about this? And if not, and you really think it does need to, be escalated, contact your indemnity, talk to your seniors, and take care of the patient.
Yeah, brilliant. I wouldn't be able, it was perfect summary. I wouldn't be able to add anything more. Thank you, Zamin. So I'm a bit aware of time, guys. Sorry. I just want to cover this last principle first, and then we'll quickly go through the scenarios. The scenarios are really important, so please don't leave for them. I'll try and figure out a way of just, let's just move on, please. So yeah.
We've covered it, to be honest. If I do something that puts dentists in a bad light, then patients may lose their trust in dentists. Rowan said earlier that the media tries to portray some of us or our career as something that's bad and negative. You want to do everything you can to flip that and give patients the confidence to go and visit their dentist, because it really does make a difference. You're muted.
Sorry, so we need to wrap it up in 10-15 minutes, but I think we can cover the scenarios. Hopefully a bit of Q&A. Sorry guys, apologies for that. So the scenario 1, you're a dentist with a patient who comes to see you because of moderate dental pain. After examination, you cannot determine the cause of the pain. So a patient comes in, they feel pain, you've examined them, but you don't know where's the pain coming from. So you suggest to take an x-ray. The patient believes x-rays are harmful and refuses. In fact, you have no x-rays in the patient's file to consult, as she never consented to take x-rays in the symptoms you have been caring for. What do you do? So yeah, the idea is that again, there's this portrayal of X-rays causing radiation, which is bad for your body. Some patients might come and saying, okay, I don't want to take X-ray. But this case is interesting because she's having pain, and you can't know where the pain is coming from without doing an X-ray, because the potential diagnosis could be that there might be an abscess, right? Zamin can correct me if I'm wrong. There might be an abscess there that you can't see from outside of your eyes. You have to have an X-ray to see that. And she doesn't want to take it. So what do you do? For the sake of time, I plan to give you guys some moment to think of it. For the sake of time, we're going to go through it, me and Zamin, quickly. So the appropriate response for this scenario one, be empathetic, okay? You know, it's so easy for you as a dental professional who knows everything to start looking down on people who have bad assumptions. Don't do that. Be understanding. These people are average citizens, may not have the right knowledge of dentistry or of medicine, and your job is to educate them. Okay? So be empathetic in terms of remain non-judgmental and empathetic to the patient's concern. Okay? Professional communication, here where communication comes in. You remember about communicating effectively and obtaining valid consent? This is what you should be doing. So ask the patient about her concerns. What are they? Where are they coming from? Are there any misconceptions for you to correct or to educate on? I will ask if she has a condition. Oh yeah, maybe she has a condition that perhaps she thinks X-ray might make worse. Ask, perhaps she could be pregnant. She doesn't want X-ray. I'll ask them. Okay, yeah. So you have to explain the necessity of X-ray, right? Explain that you cannot determine where the pain is coming from unless you take the X-ray, and then suggest to her, do you think you are in enough pain for us to take the X-ray to investigate that pain, or do you think the pain, because remember the scenario says moderate pain, so perhaps in the patient's mind they might think, okay, the pain is okay, it's not that bad, I'm not going to risk taking an X-ray, in the patient's mind. So have that discussion with her. So the way you should explain, and by the way, Zamin, please jump in if there's something you agree or disagree or you want to add on.
I think my personal preference is the first point for professional communication. So they may have something in their mind that you need to clarify, right? Ultimately, we know what will happen if they don't have that X-ray, and if we can't determine what's causing the pain, it may progress, it may get worse. And remember that no treatment, as we said before, no treatment is an option. So the patient doesn't have to have the X-ray if they don't want to, but it's our job to make sure that they understand what the consequences are. And it's also our job to make sure that they understand what the process entails, why it's positive or why it may be negative. In this case, maybe she's been misinformed because there is so much background radiation in terms of general life that a dental X-ray is practically negligible.
Yeah, I heard about this. Apparently, when you travel in a plane, the cosmic radiation is significantly greater than the X-ray you get in a dental practice. So maybe
even from eating a banana.
Oh yeah, because what's in the banana that's radioactive? There's potassium isotope, isn't it? There's an isotope of potassium. There's a little bit radioactive. I've heard about this, which is interesting analogy. A banana is more radioactive than the.
I just heard it.
Yeah. So I like what Zamin mentioned. Perhaps putting things into perspective for the patient, make things clearer. Yes, X-ray is radiation, but comparing it to the cosmic radiation from the plane or the banana, put things into perspective and might clarify this. Okay, so so explanation is basically what we've mentioned. Develop a treatment plan without just one. Benefit of the X-ray. Yeah, so explaining the benefits of X-ray, you don't have to be invasive. You'll be able to diagnose without doing anything harmful. So X-ray exposed to mere fraction. Yeah, so this idea of comparing the fraction, the X-ray radiation to environmental radiation. Yeah, you have to respect at the end of the day, after all this discussion and explanation, please respect the patient's autonomy, regardless, even if they still don't take X-ray. Remain respectful. This is their decision. They have the right to it. Okay, so scenario 2, You're a dentist expecting a patient you haven't seen in a few years. This low-income individual does not have dental insurance and makes appointments only when significant treatment is needed. Okay, so this is historically, after seeing a trend of their scheduling an appointment, you realize they only book an appointment when there's a significant treatment needed. The last time you saw them, they were unable to pay for the dental services. Okay, what do you do? Now thinking of the scenario, perhaps it wouldn't happen because Zamin, you've mentioned that in an NHS there's no debt. You have to pay upfront, right? So there wouldn't be a case where a patient gets a treatment and hasn't paid for it, right?
NHS wise, yeah, I'm not too sure about private because
okay.
we don't do private work in
Interesting.
foundation.
Yeah, okay. So perhaps this scenario is more relevant to perhaps different countries, or if you're doing private. Yeah. So appropriate response. So here where we discuss me and Zamin, financial consequences is a big factor to many patients that you have to take into account. So your response to this should be, stay focused on the patient, okay? Don't let them not paying the money make you sort of biased towards them. But I must, however, again, if you're running a private practice, you need to make sure that you're making decisions that keep your practice viable. You have to focus on the patient, then focus on the patient, sorry. But be aware you can't always make decisions that would put your practice at risk of becoming bankrupt. Because if you look at the big picture, if your practice becomes unviable and you can't continue, then all these patients that you have are going to have sort of to go to another dentist, and that will sort of create a chaos in their schedule, and some of them might not go, and you're going to put them at a risk. So it's a balance of keeping your practice working and focusing on the patient. I would greet my patient. Yeah, so greet your patient, be friendly, don't be judgmental, stay open and be kind. Has been so yeah, so things might have changed. The patient might now can afford the treatment, so be open to that. So the significant decay, yep, I will inform the patient of the extent of it. Okay, so these are where you start doing the holistic approach. You know the patient has financial struggles, so try and offer solutions. So ask, do they have dental coverage or insurance that can allow them to pay for restoration? And then this is where you offer some help. You can ask your manager if the patient is eligible for government funding. So maybe NHS can cover the treatment of the whole cost if they're eligible for some benefits. Suggest my patient contact. Yeah, so you can also refer them to a dental school where the treatment's always free. Does that mean you can confirm this? What are your thoughts on this?
Yeah, it's free. They just need to be referred in. Yeah,
brilliant. So if the patient can't afford it, it's necessary, refer them to a dental school or a dental, because it's free. No, if you can't do any of these, which is unlike, I think it's more common for them to go to the dental school, right? So I mean, this is the common way of dealing with these scenarios.
Yeah, I mean, personally, people in this scenario will likely be on some form of benefit or under 18 or job seekers allowance, something like that. But ultimately, you want to make sure that the patient is looked after. So if you need to refer them to the dental hospital, then that might be the best bet. You're muted again.
Sorry. So yeah, and again, the last one is extra. If none of that happens, which is unlikely, just provide the most suitable and cost-effective treatment for them to resolve the most immediate issues without charge. Okay, because again, patient's interest first. Okay, so the final question, which is, I really wanted to go for this question like in details, but because of the time, we're going to have to a little bit of rush. But it's the million filling question. The reason why I call it this is because all of my mock interviews that I did to get into dentistry, mock interviews, not real interviews, they asked this question, and I never knew how to respond to it. So it's really nice if I can sort of present it to you guys, the audience, so that if it comes up to you in your mock interview or actual interview, you know what to say. So the question is, you pulled the wrong tooth, what would you do? Okay, as simple as that. You know, when I first heard this, I was like, oh my God, this is disastrous. Like, uh, my GDC registration is going to be gone. I should move countries. Um, there's no way out of this. But there's a sensible response to this. The medium filling answer would be, and then again, Zamin, please jump in if you disagree or if you want to add on to this. Okay, so admit you have to make mistake, okay? The idea of this, you want to be honest and act in integrity all the time. Don't hide it, don't try to cover it up and try and fix it without the patient noticing. Admit the mistake, okay? Say, unfortunately, I've done a mistake, I've accidentally pulled the wrong tooth. Explain how it happened. Yeah, the patient has a right to know how that happened, otherwise they might think you're completely neglectful. One example could be, you know, you're a trainee and you chose the wrong tooth from the X-ray, right? You took an X-ray and you thought lower left 4 has abscess in the root, but then when you did the extraction, you've chosen lower left 5, okay? And I think it's possible for this mistake to happen. I'm not saying it's common, but it's possible, right, Zamin?
Yeah, definitely.
Yeah. So explain why that happened. It could be another reason. Just make sure you explain that. Pause and allow them to express their emotions, okay? They might get angry, surprised, frustrated. They might have questions, let them ask, okay? Be open.
This is key because a lot of the time, as dentists, we're pressed for time with the NHS, for example. It's a really tight system. So we may not give the patients enough time to comprehend and understand what's happening. So pause and allow them to express what they want to. That giving them, even if it's like 10, 15 seconds, for them, it feels like a lot longer. And it just means that you're treating them in a lot more humane manner because you're not just saying, okay, I pulled the wrong tooth out. Okay, this is what we do, X, Y, Z, right? You're apologizing, you're admitting what you put your hands up. You made a mistake, admit it. You apologize, you pause. That's the key thing, pausing and allow them to take it in because a lot of people actually miss that point. And I think it is really important.
Yeah, exactly. Zam, the important bit of what Zama mentioned is the tightness of the practice you're working with, and it's just a private. And don't fall into the habit, the idea of I need to do things quickly. I can't do this. No, patience first. Okay, patience first. Apologize. Yeah, don't forget to apologize when you do a mistake. Show them that you care and you're sorry. Explain that you have indemnity that will provide. Now, here's the thing. One thing I don't like about this is compensation. The indemnity doesn't necessarily provide compensation. It can in some cases, but it's for the indemnity to decide, not you. Okay? So just explain that there's indemnity that protects you from any mistakes that you do, and they can contact them and explain to them how they can go through this process. Again, it's not always compensation. It's the indemnity that decides what it is. Make sure they understand what to do, so make sure they know what they're doing from then. And one thing that a dentist, I've asked this to a dentist in my work experience, and they've mentioned, it's always nice to provide them options. So also, like for example, you can say, okay, I can do you an implant free of charge, or a denture free of charge, or a bridge free of charge. And if they like it, they can consent to this, and then you can inform the indemnity, okay, this problem happened, but I offered this solution to the patient and they're happy with it, right? Because that way you're being clear and things are going the way you want it as well, because you're the one who's making these options, because if you're not going through the effort of fixing the problem, the patient might just completely change their dentist and not come back to you and not trust you for what you did. But the fact that you're offering solutions and the patients are agreeing to these solutions is sort of fixing the problem as a whole, right? Zamin, what are your thoughts on this?
Yeah, so my go-to may not necessarily be shove indemnity down their throat or shove a complaint process down their throat. Watch how they react. They may want to pursue it, and then definitely, yeah, you can mention indemnity. Personally, I don't have too much experience with this, but you can mention, that they can make a complaint, and I think the perfect thing that you said is the process that you can not rectify, but what you can offer to sort of offset against. I know you can't put a tooth back in, but you can offer them something to try and alleviate the pain that they're going through, the emotional pain, that they've just lost that tooth, a bridge, an implant, a denture, whatever it is. And then, ask them if they have any questions. And if they do, encourage them to ask and answer them honestly, because when you make a mistake, there's nothing worse than being dishonest about it. Because if you are, if you're shady, or if you try and cover up what really happened, the patient will feel cheated even worse. But ultimately, you have to be responsible for what happened. You need to be professional at all times. And that's really how I would manage it. I would sort of judge how they're reacting, but remember that there are measures in place. So if you feel that it does end up going down that route, then talk to them about it. Make sure they understand what to do, the process. If someone wants to make a complaint, one thing that we didn't actually mention earlier in terms of this was the GDC principle. If someone wants to make a complaint, you can't try and hush them up. You can't say, okay, don't make a complaint. This is bad. Don't do this. You have to actually encourage them. If they want, you can't. The other principle was act in the manner to portray the best image for dentistry. You can't say, oh, go make a complaint. Oh, complain about this, complain about that, because you're not encouraging them in that sense. But if they say to you, oh, I would like to make a complaint, you then explain to them the process. You can't just keep them quiet.
Exactly. We've got to mention that, which is important. Thank you for bringing that up. Yes, you're allowing them to complain, but don't try to make them to sort of feel bad about complaining and make them feel guilty that they're being sort of crossing the line or coming across the route. Be open, be encouraging, like Zamin mentioned. It's not insurance. Again, sorry for this. It wouldn't be called insurance company.
Indemnity, yeah.
Indemnity, and let them know what happened, and then and document everything. By the way, everything you do, make sure it's documented. It's in the patient's note within 24 hours, like Zamin mentioned, and follow up with the patient and the indemnity company in a few days. Okay. This is it. Thank you for being here. I'm aware we're not going to go through many of the questions submitted, but there's just one interesting question. Two interesting. One quick one. One of people ask, where do you get this list of principles from? Guys, literally go on Google, type GDC principles or General Dental Council principles, and they're there. And there are much more details. This is just a summary, okay? And you can study it more and use it in your interview and bring it up. And by the way, I can guarantee you, all ethical scenarios that they ask you in an interview are to test these principles. Yeah, I cannot think of a single ethical scenario or role play I've done in my actual interviews that are not linked to these principles. So learning these principles in depth will prep you for these role play or ethical scenario questions. What was the other question that I wanted to ask? Okay, so something we've already answered, but just to reiterate, are the patients allowed to change their choice of treatment mid-treatment? Zam mentioned this. Yes, they are allowed, because things might change. They might have learned new information and they don't want to proceed. So of course they have the absolute autonomy to change their mind. Okay. Sorry for keep you up that late, Zamin. I really appreciate you staying here for that long.
No.
Thank you so much. I can't lie. You added so much to this. I've learned so much from you. Thank you for sharing your thoughts and expertise. And
I want to bring your attention to one more question that I've just noticed come up. What made you choose Barts out of other London unis? So this is a really for me, I'll be completely honest, I didn't exactly research all the unis I applied to. If it's okay, I just want to run through this one last question, because I think some people are asking about the certificate from this. You don't necessarily need to bring it into the interviews, but if you want to take your certificates across, that's completely fine. That's up to you guys. So that answers that question. But the main one that I want to go to is, what made you choose Barts? I didn't really research universities before I applied to them because I thought that dentistry is the same degree regardless of where you are. The only universities I visited were, in fact, the only university I visited was Cardiff, and that's just because I wanted a day out with my friend. So, in terms of why Barts, I don't have a reason, but what I can tell you is that dental school, regardless of where you are, maybe because I was at Barts, I had a bit more fun, but it's the best thing that's ever happened to me in my life. And you meet so many people who are like-minded, but that's also university in general. One thing I would say specific to Barts, though, is the structure of their course is one thing I really, really liked. So they focus on lectures, but also on problem-based learning, where you're given a scenario and you have to work through it with your peers, and you're learning based on a scenario, because there's nothing better than learning from cases. A lot of you will be following Instagram dentists, right? Go look at you may not understand necessarily what's going on, but ask someone who may know, maybe message them about their cases and what they do. I know that I am contemplating and I would like to set up a page for my own cases soon. But yeah, it's one thing about Barts is the structure of it. It's a very close knit group, because what happens is you're in London, which is a fantastic thing. I think London is an amazing city, but the way they structure it is you're in clinics from second year onwards, but you're with your group of 9 clinical peers, and although you're not treating patients till second year, you're in clinics from the get-go. You're in clinics from day one. They show you around the clinics. You may shadow some older years. I can't really remember what I did in first year. But those are a couple of things that stand out to me. So the way they structure the course, the fact that you're in London, and also one key thing is research the area. I'm not going to give away too much because you can't really give away, what comes up in the interview. Can't do that. But research the area of where universities are, because that will play a big factor in the demographic of patients that you treat. Maybe they have a particular condition that comes up. Maybe they're from a particular background, things like that. But when you're in London, you treat people from different backgrounds, and that was a key thing for me, because in London is so diverse. You're going to see British people, you're going to see Asian people, you're going to see African people, for example, and having that broad experience just sets you up so much better for dentistry in general. Rowan, why did you mainly choose Barts?
Yeah, so it's very interesting points that you brought up. I particularly like the last one, which is about patient demographic and diversity. We've talked about this during the GDC principles. We said it's really important to consider everyone's background and respect it. And there isn't a better way of learning how to do that only by facing patients from different backgrounds. And that's what's good about being a student in London. But for me, I think Barts, what I liked about Barts, here's the thing. I don't like being diluted in a year group. What I mean by that? So if I felt the year group is large and there's this amount of staff, I would feel like, okay, I'm being diluted. I'm one out of 200, 150 students. But in Barts, what made it stand out to me particularly is that there's around 70, 80 students per year. So I felt it'd be nice to be one person in that year group, because then I'm less diluted. When I'm asking questions, the staff are more available. There's more one-to-one interaction with the staff. Whereas in other dental schools, you have greater year groups, which for some people could be nice. Some people might say, I like a larger year group because I want to know more people, etc. So it's up to you really. But for me, that was my personal reason. And again, it's kind of, obviously me and Zamin, we've only went to Barts, so we can only give you reasons or good things about Barts. But please do your research, be unbiased, and the most important thing, which I didn't think of, which I realize now, a dental school is good. All dental schools are going to make you a dentist. Okay? But when you're choosing your unis, make it sure the choice is based on your individual preferences. So consider social life. Consider traveling. Do you want to stay in the city you live in, or you want to be in a different city? Consider being away from home, away from your family. Consider, can you live out? Can you not live out? Consider your friends are going there, your friends are not going there. Although I don't like the idea of choosing a uni because your friends are going there, but this could be something for you. But personally, this is not a wise thing to do. So yeah, don't fall into this rabbit hole of thinking, oh my God, this uni will make you a better dentist. This uni is going to make you, give you a PhD in 2 years after graduation. It's not like that, okay? All the unis are going to make you a good dentist, a competent dentist. Otherwise, the GDC will just shut down the uni, right, Zamin?
Yeah, so they inspect the universities, and they look at how the students perform in exams and how the unis push the students. So all the unis will have requirements for the students to meet. So when Rowan enters, unfortunately because of COVID, Rowan's clinical experience has been tainted a bit. Yeah, that's an issue. But when you get into the older years, or even in second year onwards, you have requirements that you have to hit. So you have to do X amount of root canals, you have to do X amount of fillings, X amount of crowns and whatever. And every uni has those requirements. So you will get the experience regardless. And a key thing about uni is it's so free-flowing and easygoing that you decide what you want to do. So if you decide that you're going to be antisocial and stay in your room all the time, then that's on you. That's not going to change regardless of the uni. So Rowan mentioned a couple of really good things, like consider things apart from just studying. I mentioned things only about the course, really, but it's 5 years is a very long time. It's half a decade. Like, your friends will be graduating, they'll get jobs. I have a couple of friends who are married, and here I am still doing exams. Yeah, like my mates went on holidays, things like that. Like, it's a long commitment, and you just need to have that conviction that you want to do it. And if you have that, regardless of where you go, you'll be fine. Because as Rowan said, every uni will make you a dentist, and everyone ends up doing foundation year. So everyone will have the training that you need. So it's mainly personal decision that lets you decide. So one thing for me, for example, was I liked the fact that it was a small cohort, and because it's a small cohort, you have more access. I felt that you have more access to facilities because it's more focused. But also I got lazy because I thought if I want to commute, I live in Watford, I can commute to London. So that I was also lazy, I'll admit.
Yeah, fair enough. Do you think we can end it here, Zamin? I don't want to keep you for that long. Yeah, brilliant. Yeah, so I want to take this last few minutes to thank everyone in SAMDA who made this happen. There's a lot of people behind the scenes to make sure the technical sides are working. So thank you for you. And special thanks to Zamin, Dr. Kasvani, for joining us in and sharing his, diamond golden experiences that are very exciting and useful to everyone. I wish I had this conversation before applying. Maybe I would have a better start to uni. So thank you so much, Zamin. Appreciate it. And if you can be kind, join us another time if you feel that was, this was fun, like I did. I don't know. Yeah. Brilliant. So, yeah, and thank you for our audience for staying that long, 2 hours. Apologies for the time. And stay tuned for the next 3 sessions. The next one's going to be about anatomy. The one after that's going to be about the overlap between medicine and dentistry, which is highly important. I really recommend you to stay in that because it comes up a lot in the interview. And the final one is some fun x-rays. Okay? So if you're not interested in some diagnosis or for some x-rays, join us in. Thank you so much, everyone, and I will end it here. Take care. See you soon. Bye-bye. Oh, by the way, everyone, sorry, everyone. Please, feedback form. Forgot about this. Everyone, please scan this barcode, QR code to fill the feedback form. I would appreciate any feedback. Again, this is like it can be a complaint procedure. This is my way of giving you an effective complaint procedure. If there's something you didn't like, or if something that you'd like, if there's something you'd like me to do more of, please let us know. And thank you so much. So I'll leave it here for a couple of minutes. But Zamin, you don't have to stay for this. Thank you so much, and I'll see you soon. Take care.
See you guys. Thanks for having me.
Pleasure.